Hi, Christy.
Hi,
I should say hi, Dr. Evans. I'm sorry.
I'm happy. I'm so happy to see you.
I'm so happy you're here. Like long time coming, and you're just such a bright light, and you have so much to share with us today. So let's get into, did you always want to be an OB-GYN? Can we
Oh my
start
God.
there?
Sure. Yeah. So no, I did not. I did I talked to my mom about like, oh, when I was growing up, I wanted to be a pediatrician, I wanted to be a teacher, I wanted to go into international politics, and I was kind of all over the place. Yeah, and then I went to college for business. I was an accounting major
Oh,
in undergrad
wow.
and went on to work in public accounting for a number of years, and then kind of realized, wait a minute, I there's something different that I want to do in terms of like caring for my world and my environment, and went back to school for medicine.
Oh my gosh. I love this. This is what I love about doing this show is like I've known you pretty intimately for a little while and like never knew that there was an accounting background in your life. Like that's crazy. Okay. So you
Different
went
world,
back
different
to
thing.
school, which I feel like is much more rare in the medical field. Were you older than most people?
I was, yeah, I know. Yeah. I was so not really kind of having sort of any, like even in undergrad, I didn't really take any like real science classes. So I had to kind of go back and do all of like the basic science and all of
Wow.
that. But it was good. So yeah, I went back and did all my basic science classes, did a lot of great. I had an amazing job at UCLA for a couple of years running a research program for pediatric craniofacial surgery. So got a lot of clinical and basic science research under my belt that really kind of helped kind of prepare me for medical school. And then probably the biggest aspect of or like formative time was after I graduated from college. I ended up spending a summer in East Africa. And even though I was doing work, it was with the Student International Business Council. So we were doing microfinance loans and different projects and teaching basic bookkeeping skills. But a lot of what we did was work in the healthcare sector. So we were working with women who were HIV positive, trying to help set up micro loans and small businesses for them. And what got in the way was their health.
Mm.
And it became so apparent to me that without your health, it's really hard for you to be productive and serve your community and have a livelihood. And so that really impressed upon me the importance of health and access to good health care and all of that. So that kind of propelled me towards medicine.
Okay. And then how did you pick this track?
So, I mean, I have always been interested in wellness. And I was in medical school and then also in residency. It was pretty crazy how so many of the studies and the research that's being done to recommend treatments and protocols and everything from how we approach like certain symptoms have is almost exclusively done on men,
Yeah.
and women have a different physiology. We are not small men. We are different, and we have different hormones, and we have this infradian rhythm, and with our cycles, and that is just so fascinating to me. And also, I feel like it's so important that we are able to care for women the way that we need to be cared for throughout the course of our reproductive lives, from adolescence and like puberty and then reproduction and fertility, and then now in like perimenopause and menopause. I think all of those transitions warrant a special approach, and I love it. It's so fun, it's fascinating to me, and as a woman myself, kind of going through my own journeys through some of these transitions. Yeah, I I knew I wanted to do something in women's health. I didn't know exactly that it was going to be OBGYN right away. I was even kind of thinking like cardiology, focusing on women, women's cardiology. But I think when it came down to it, OBGYN, it's such a cool field. It is a combination of surgery and kind of this exciting labor and delivery environment, delivering babies into the world, and then also kind of more of the preventative whole body lens of kind of gynecology care, hormone health, and all that. So it's to me, it's like the best of all the different aspects of medicine. So yeah.
I love it. And that's a great segue into you're also a doctor of functional medicine. So what does that mean? Um, like I really want to get into it, but let's start with what does that mean? And does that mean you did a whole nother program on top of med school?
I did. So I went to medical school, that's 4 years, and then I did a 4-year residency in OBGYN. And so I graduated from that program. I'm board certified as an OBGYN. And then a few years into my practice, I decided to go back and get my training in functional medicine. So I did that through the Institute for Functional Medicine, and it is a 6-part series. And so what functional medicine is, it's a different, to me, I think of it as a different lens in which we view the body and view all of the different systems that make up the body. So instead of kind of just thinking of the body in silos, like I'm a gynecologist, all I care about is your gynecologic organs or like your specific reproductive hormones. I care about your whole body and everything is interconnected. And I have to appreciate that and kind of integrate that into how I care for you and how I approach the symptoms that you might be coming with, all of the issues that you have when you're trying to get pregnant or when you are struggling with, certain symptoms relating to your menstrual cycle, for example. I'm not just thinking about that in a silo. I'm really thinking comprehensively about all aspects of your care, including nutrition, your stress, your environment, your lifestyle, your metabolism, your hormones. So kind of thinking of everything just like more broadly. What I love about it is that it gives me not only, it just gives me an extra set of tools to help my patients. So I have all of the things that I've learned in my conventional OBGYN training. I can be in the operating room, I can operate, I can do procedures in the clinic, I can prescribe medications if you need that, but I also have the tools to be able to support you in your lifestyle.
Do you do people know this right away when they come to you most of the time? Or is it like a pleasant surprise? They're like, "Oh my God, she does so many more things."
So I work for a company called Almond ObGyn, and this is their mission as well. And so we really set out to make this our approach. All of our clinicians practice this way, and so I believe that we're starting to become known to have this approach. So I think that when patients do come to me, I think that they now sort of have this understanding of what kind of care they can get when they come to me.
And how does it look different from the get-go, from like a basic appointment with you? Or do you wait until you see something that might need to be interconnected to go into your functional medicine toolbox?
Mm, mm. That's a good question. I mean, I think I have that lens always as I approach any patient. So even if she's coming in for some simple thing like a yeast infection, it's not just, I don't think of it as a simple thing. I think of it more broadly. What's going on with your immune system? What's going on? Why did you get a yeast infection in the first place? Can we go down and drill into, well, what's going on with your vaginal microbiome? So I think I'm always kind of thinking about it from that approach. Um,
And then
one
like, sorry, go ahead.
Well, one of the really cool things that we just launched at Almond is what we're calling our functional assessment. So when you establish care with us, we actually have you go through a series of questions to really kind of understand how your what your baseline health is. And we think about like the pillars of health. So your sleep, your how much movement you're getting over the course of the week, your nutrition, your how you relate to stress, your social connection, like all of those things are really we think of that as the pillars of health. So we're asking questions about that to really kind of get an understanding of where are you right then, right? You get a score, and based on your score, we can utilize that to help understand, you come in for a particular reason. We'll take the yeast infection example, but where are you on all of those other aspects of your life? Because those things may be impacting the symptoms that you're coming in for.
Whoa. So then do you figure out in terms of treatment, you might not only need to treat the yeast infection, or you might need to treat everything else, and that will then clear the yeast infection. So, from a medical standpoint, are most medications that you would need to prescribe in a holistic approach covered by insurance, or is it the kind of thing? Because I feel like with functional medicine, the myth, and it's not just a myth, right? I mean, you're very specialized and different because you're with a clinic that this is part of the approach, but people are always like, functional medicine is so expensive, and all you do is all this testing, and then they're going to give me all these medications that aren't even covered, right? So is it sort of, and you know me, I'm like into the woo, but is some of the medication more like herbal and more not necessarily FDA cleared or experimental? Or how you see what I'm saying?
I love this question. Yes, yes, yes. Okay, so first of all, we I want to make functional approach accessible to as many people as possible. You're right. Functional medicine, when we think about functional medicine, when we think about like all those advanced testing and like that can add up really quickly. And really, when we get down to the what like the definition of functional medicine, there's nothing in the definition of functional medicine that says anything about expensive testing. It does not have to be. And to a certain extent, like as we're kind of working up a particular issue, there might be a more advanced testing that we might want to do, but that's not what I jump to pretty much ever. I
Mhm.
don't jump to that. I think we start with the basics. We start changing your lifestyle does not need to cost anything.
Mm.
So I want to work within what my patient has in terms of her, like what's accessible to her. But also, I mean, Almond, we take insurance at Almond. So we try to make it accessible, this approach as accessible as possible. Um, so yes, I mean, again, I think about it as just having a larger tool belt, so I can absolutely prescribe medications, and when that makes sense, that is my go-to, because generally it's way more cost effective for my patients, FDA approved. But there are certain cases where we might have to be a little bit more creative and augment that, and so I'm really grateful that we have the ability to do that as well.
Amazing. And to that point, how in general, like tell me about almond. How did you end up there, and why is it different from like another OBGYN office?
So I've been with Almond for almost 3 years now. I started as one of their OBGYN providers. I'm now their medical director. So Almond is a full scope OBGYN practice. They really the why I joined them is because they have the same approach, the same philosophy as how I practice medicine. So they really have this fusion of conventional OBGYN with a more lifestyle oriented approach. So we have a little bit more time with our patients. We can really focus on nutrition and hormones and kind of overall lifestyle. But I also operate, and we actually have a really, really cool group pregnancy care program that I'd love to talk about too. So we
Yeah.
try to just bring a different, more creative approach to the totality of women's health.
Yeah. Tell me about because I think the group pregnancy program is awesome. So tell me, well, let's talk about that specifically, and then more broadly, like how your membership, that you have a membership and how that works.
So we are a membership-based practice. We take all the major insurance companies, but we do have an annual fee And that annual fee allows us to have longer visits with our patients. We have this beautiful platform where the patients have access to us. They can text us anytime. We have good availability. We do extensive testing here in the clinic, and we try to give our patients a ton of educational materials, for every reason that patients come in to see us. So yes, we have this membership based
And let me
approach.
just add one more thing, as long as we're on the membership piece, because I feel like that is a result of and reaction to the state of our insurance care. Because, like so many of us, we go to a doctor and then we're like, they rushed me out in 10 minutes or 15 minutes, and that wasn't enough time because they need to meet their volume of patients. So the membership fee, I mean, I just think it's such a great model. It's a bummer because who wants to pay even more for their doctor when they're already paying for health insurance? But it's a small fee, and I feel like it affords you quite a bit more than you would get elsewhere at a regular OB-GYN, especially with the membership. I mean, with the group dynamic.
So, I mean, I more and more OBGYNs I know are going outside the insurance model. The ones that are, I mean, because they're seeing that they're not getting reimbursed, they're not able to provide that level of care that they want to, and for their patients. And so, in order to have longer visits with their patients and provide the type of care that they want to give, they are going outside the insurance model. We are really trying to stay within this
Of course.
existing, working within our system.
Yeah.
And so that is what allows us to kind of fill that gap.
Mm.
So yeah.
So tell me, I mean, the group model also fills that gap a little bit. It's like a way for, it's a workaround that works for everybody. So tell me about that particular model.
Okay, so group pregnancy care is essentially our patients who come to see us for pregnancy care, and we're really utilizing what we call a tandem care model. So patients come to us, they establish care possibly with an OB, maybe a midwife if there's one in the area, but then they come to us for this midwife based group care. And so what that is women who are have due dates in the like similar period of time, like will be grouped together, and they will go through their entire prenatal care together. So all sessions are held in a group model. There's, maybe 6 women with their partners, with our midwife, and we always have guest speakers. And that's the coolest part about it, is that we have this, it really feels more of a community, a supportive environment for our patients. So what we've realized is that, as an OB, and I, in my previous practice where I was seeing patients and for 10 minutes per visit, there's only so much as an OB I can relay to my patient about the importance of nutrition and exercise, and what to expect in when you go into labor, and all of these different aspects, and then preparing for delivery and postpartum, and the importance of pelvic floor physical therapy and lactation and mental health and all of that. There's too much to go through with our patients that we feel like are absolutely essentials in those 10-minute periods. So our sessions are 90 minutes. We get to be able to share all of that learning with our patients, and they learn from each other. I think that's like the most beautiful part about it, is that we view ourselves as facilitators, and they learn from the things that they're learning about it, in their own pregnancy. The same things that one woman struggles with, it's really likely that someone else is struggling with the same thing or something similar. And we have guest speakers that come and are able to give our patients, that level of education. Mental health, we always have a therapist come. We always have a lactation consultant come. We have a baby nurse come. We have pelvic floor physical therapists come. We have doulas come. So we really try to make it a really beautiful learning environment for our patients.
Do you feel like since menopause and perimenopause are trending so heavily, are you getting more of that demographic as well?
Yes. Yes,
Okay.
and actually, so I completed my Menopause Society certified practitioner about a year ago, and I've had a lot of patients coming to me since then.
Mm.
And I think it also helps that I'm kind of in that period of
Yes.
my own life, so
Yes.
I can really, really relate to it, and
Yes.
that is actually like such a passion of mine too.
Right. Okay, like from a on a personal level, well, I like okay, so many things. How did you, I guess the way that Almond is built, it's like a cross, what I love about it is like a cross between a startup and a very non-startup functioning wonderful medical practice. Is there like what does an expansion fantasy look like to you? Because I just knowing you from both the business side and the medical side, I think that's a really people don't think about the medical side or the business side of the medical practice, and you're kind of have hands in all of it.
Yeah, so there are two aspects of the business that we are really excited about in terms of expansion. One is, and this kind of speaks to what we were talking about before in terms of the functional approach and just getting a more expansive understanding of our patients, like overall health and wellness. We have a program, a service line called Baseline, and essentially it is lab panels that are kind of appropriate for different women in different parts of their lives. And so it's hormones, it is more broadly understanding our metabolic health, our micronutrient status. And so we offer those lab panels with a comprehensive kind of evaluation. And we are offering those across California right now and soon to be across the country.
Awesome.
We are also one thing that's been pretty cool about our practice right now is that we offer virtual care. So for our existing patients, we have virtual appointments, and that can really make sense in so many different ways. A lot of what we talk about, we're talking, a lot of it is kind of understanding our patients' symptoms, understanding, maybe reviewing their lab results, and understanding kind of whole comprehensively like their whole body, kind of and coming up with a whole body approach for how we're going to tackle their symptoms. So a lot of that is done virtually, and we are really excited to expand that virtual care again across California and soon to be across the country.
Awesome.
And I think that will allow our patients who maybe already have, established care with an OB or a primary care doctor, but just want a little bit more from that functional approach. They can get that through us. And the enhanced testing, and just more of the lifestyle aspects of care.
Are other physicians on your team also, do they have the functional medicine piece or does that always defer to you?
So everyone that we've hired absolutely has that functional approach. So they all believe in root cause medicine. They all believe in the importance of nutrition and lifestyle. And so we all have a very, very similar approach in how we care for our patients. We also have brought on health coaches and nutritionists to help support those our patients in that way as well.
Amazing. Now you're a mom. So let's talk about your like insane, the all of the balancing that we all have to do. How do you do it? What are your tips and tricks? And what do you do for your own self-care?
Oh my gosh.
Mhm.
Yeah.
Nothing, and I know it, and now you're busted. No, I'm just
Yeah.
kidding.
Little struggle. Yeah, so I have two boys. I have a 4-year-old and an almost 6-year-old. They are the loves of my life. I live for them. They're amazing. Balance is ever changing. Um, I don't know if I have any tips. It is hard. It is really, really hard. I try, and it's really hard and as a doctor and being on call and that sometimes I do have to take my work with home with me, or I'll get a phone call, and so that can be challenging. But as much as possible, kind of just like siloing, making sure that I have time set aside one-on-one with my kids, and give them the support that they need as well. Self-care, oh gosh. I try to get out, and I have my Aura ring. I try to make sure that I get my steps in every day. But what that looks like for me is I try to get out in the morning. I try to get as much sunlight as possible. It's so important for my circadian rhythm and my vitamin D levels, and my mental health. And listen to podcasts while I'm doing it.
Yay.
And then I would say like the one, probably the biggest tip, and I harp on this all the time with my patients is I love my sleep. Sleep is so important to me. I do everything to kind of prioritize my sleep. And I know that sleep is so, so important for our hormones, for our mental health, for our metabolisms. It's important for so many aspects of our health. So I take my sleep very seriously.
What's your ideal sleep hours look like? What time do you go to bed? What time do you get up?
10 to 6.
10 to 6. That's my ideal too. I'm still tired though, always. I
Oh.
mean, I know that part of it is so freaking hard. Um, and you're also good. Don't you do cold plunges? Aren't you like don't you love a cold plunge?
I love a cold plunge. I love it. Yeah, yeah, I go to this place in Venice and I try to just, yeah, 3 minutes of it. It is like it invigorates me for the rest of the day. It's amazing.
Ugh, it's my nightmare, but good for you. Yay for you. I've watched you do it before. I will continue to never do it, but just watch other people do it. Um, okay. I started just doing these like rapid fire questions and closing out our episode. Will you play with me?
Oh, I would love to.
Okay. Easy one. We'll start easy. Coffee or tea,
Tea,
iced or hot?
iced,
Oh my God, same. No one ever says that. Um, beach or mountains?
beach,
A wellness trend that you're actually obsessed with right now. We might have just covered it, but
cold plunge.
cold plunge. Yeah, you love that thing. One thing you never thought you'd be doing, but now you love.
Ooh, cold plunge.
I knew you were going to say that again. Okay, finish this sentence. I feel most like myself when.
When I'm with my kids and I'm just playing and just like in the small, quiet moments, like nothing fancy, just in the playroom or whatever. Yeah.
Those are the best moments. I thought you were going to say when I get out of a cold plunge. No, just kidding. Okay, well, we're going to link out to Almond and to you. Anybody local or in California, definitely check out Almond. Christy, I adore you. Thank you so much for being here.
Abby, thank you so much for having me. This was really fun.
Good.